Hi everybody, my name is Andre. As you can see, we're coming to you today from our state-of-the-art GE64 slice CT room. We've decided to do a monthly web series with Rubik after
Gladly.
wanting to start for so many. We've talked about it so many
we
times
actually
to get
talked about
this
a
going.
newsletter, but then this is
Exactly.
better than a newsletter.
So we're excited that we're actually here. We're going to start, and we're hoping to provide our audience a lot of information when it comes to the field of radiology and the different tests that are out there. You hear a lot as to what to expect, but unless you're, off firsthand, you're shown what you're going through along with the equipment and the different
patient
testing.
comfort and all the above to make the patients comfortable, patients feel better, feel free. All those things we're going to talk about.
The more they know, the better prepared you'll be for your
Absolutely.
exam. We'll give you a little bit of a history as to, where Glenoaks Imaging came from, how long we've been in business, and maybe Ruby can talk about the different exams
Sure.
that we do.
Today's August 1st. I just want August 1st, 2017, just for the history, for the, hopefully we do this for years and we go back and watch the first one. Our background is been a technologist, radiology technologist for me and Andre for almost 15, 16 years, each of us. Yeah. So we have about 35, 36 years combined experience. We worked many hospitals, we worked at an imaging centers, and then we finally decided to open up, to get this going in our community, and to help our people, basically, to help the place that we live, all around things, and just, it's make it comfortable for the patients. The service history, we opened at 2011 August.
Can't believe it's been over 5 years already.
It's been 6 years now. It'll be 6 years in August this month, actually. We had the enough experience to make the place not only visually but as far as like service, to make it a top-notch center, top-notch center, diagnostic center. And maybe we can talk about the modalities that we have, the services that we give.
Listen, we perform from the simplest chest x-rays to very difficult, vascular studies from head to toe. The modalities that we have, our Glenoaks Imaging professionals, are, of course, CT, which you're seeing that right now. By the way, this is the latest addition to Glenoaks Imaging. We also have an MRI department, ultrasound department, X-ray and bone density. The reason we decided to do this web series is we hear so many questions, whether it be through the phone or just talking to our patients. I'll throw a couple of things out there that we're going to be covering in the future. What's better, open or closed MRI? Why do you need an injection? How do you deal with claustrophobia? How much are prior exams important? When you're dealing with some kind of a diagnosis, you want to compare the previous studies to the current ones to see if there's any progress or regress. We'll try to pick topics that are going to be helpful for our viewers, with keeping our ears outside and see.
Basically servicing the patients, servicing the community, servicing. A lot of patients, when they come to get the scans done, they don't know what to expect.
Yeah.
So
or they're given the wrong information.
Or given the wrong information. So we're gonna educate. We're gonna try to educate everyone, whoever is going to be watching our web series, to what to expect to when you go to an imaging center. What to expect about the study, how to prepare for the study, and what to expect after the study. So all these things are going to be in effect in the future, and hopefully we can help.
What's a good time frame to have your report go back to your doctor? I know we're all anxious when you have a test done. Sleepless nights, and
of course,
so
the results. You want to know
what's
as
an
soon as
expected
possible.
time period? How fast do we get it to the recommending doctors? And maybe we'll show you how to even look at a report. In the future, we'll go over a few reports because the wording is very difficult. But if you know what you're looking at, of course, with the help of nowadays with Google search and all that, you'll be able to read your own reports. So we'll promise we'll look at some reports moving forward as well.
Sometimes Google gives you too much information, but again,
it's a two-edged sword, right? It's,
of course.
Yeah,
of course. And we'll tell you how to access to us, how to get access, how to make an appointment when your doctor gives you a prescription to get a scan done. We have free transportation for patients. So basically, all the access that you guys, we're going to give a lot of history and a lot of past, present, and future for our imaging center and for the radiology field itself.
Right. And also, we'll create some kind of a forum where you guys will be welcome if you have specific questions, or if you want to see, an MRI scanner from, whatever you guys want to see. We'll make sure that we give you as much inside access as possible, and I'm pretty sure everybody will love
It's
the
an
fact.
interesting field. It's a very interesting field, and people that are not in this field, it will be a new thing for them to see and to learn.
So let's talk about a little bit as to where can our audience see our shows and read about us more.
You can like us on Facebook. You can follow us on Facebook. You can follow us on Instagram. Pretty soon we have a YouTube channel coming up that will be again very educational. You can email us with your concerns, info@glenoaksimaging.com. You can call us at 818-230-3400. Any questions or concerns about the medical imaging field, we'll be more than happy to help you.
We'll try to keep it to the point, give
Absolutely.
you guys as much fun and useful information as possible. So, not only for you guys, your parents, your grandparents have exams coming up, and by you knowing, you'll be able to help your family members as well. We try to stay healthy, but unfortunately, it doesn't work out that way. So, radiology is a huge part of the medicine field. Without knowing what's wrong with you, first of all, you can never cure it. So, that's where we come in.
Yeah. Stay healthy and love your body. That's it.
That's about it, guys. Thank you for our first show. And
see you next
keep
month.
looking for us.